doctor's appointment, and I did do some filming, but they don't allow us to film in there, so it's really more just audio. And I will put that in at the end of this. Sorry, I was watching the road. Tyler's driving. And it's raining. It's gross. But I will put that audio in at the very end of this in case you guys want to listen to what Dr. Murray had to say. And we just kind of went over the procedure and what he said. So not going to be a very long video, but that's what I got for you. We're going to get this handsome guy back home and in the bed and get some hot chicken broth and whatever else he wants to eat on his stomach because he is not feeling good. Feels better than he did yesterday. He hasn't been running, he didn't wake up with a fever. And as long as we keep medicine in him, he's okay-ish, but he runs out of energy really fast. So we are going to do that. Is there anything else I need to tell them?
I don't think so.
So anyways, I don't know when we will see you guys again. Probably Christmas or maybe the day after Christmas. But yeah. So you guys, what were you doing?
I was just giving him kisses, and he was he was trying to back up, and he wasn't doing a very good job of it. No. No.
He's like, what the heck?
Okay, I'm
He's
done.
like, bye. Alright guys, so despite my husband feeling super duper crappy, he got me my Christmas present. And I got it early because he really wants me to be able to start using it. So da, 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 da. I am so excited. Here, will you take that? So he wanted to do an unboxing with it, so we're going to open it.
Just in case anybody's not super familiar with GoPros, this is the GoPro Hero 5 Session.
I don't know what that means, but I am excited.
So basically, it's the version of the GoPro that doesn't have a screen. But the GoPro Hero 5s, they have...
Did I get stickers? Dude, I got stickers.
It has video stabilization, which is really nice because there's a mechanism inside the lens that just kind of helps keep the camera pointed at what you want it to be pointed at, which is really nice. Some of the older GoPros don't have that. So in addition to being waterproof and taking 10 megapixel photos and all that stuff. So yeah, really excited that we were able to get this for Christmas.
I'm gonna break it.
Let me see.
Oh, hold on. It gives me instructions right here. So I flip that up. Gotcha. Okay. Alright. And then I don't know what these are, but they look sticky. They look like I can
Yeah, these are probably so that, because I'm going to guess they probably clip onto the bottom.
Yeah. I don't know what this thing does.
So like if we find a spot,
We can just...
stick it and keep it there.
Oh, and then look, this little doohickey moves.
Mm-hmm. Yeah. There we are.
And then you... It sounds like somebody's here.
And then kind of as we have more funds, we'll get her, accessories to play around with, and like little selfie sticks and whatnot.
A tripod.
A tripod. And all that fancy jazz.
Oh, there it goes. Huh. I'm not very good at this, Tyler. You can make it like off. Wait, now how do I put it back on? Tyler's arm is getting tired.
Just a little bit.
So, the other night, we had, and this is like the second time that something like this has happened in 2 months, this is the second time something like this has happened within a month. But a few weeks ago, we had somebody break into our car and steal our aux cord. And then a couple nights ago, we had somebody, my stepdad had some roofing metal that he got to put on the house that we're building next door. And somebody, I guess, in the middle of the night decided that they wanted it, and they came and took it. So, and we live in like a really good neighborhood. So, stuff like that to happen around here is really like
discouraging.
Yeah. I feel like a kid who just got a new toy on Christmas. Well, yeah, I knew that goes in there, but it looks like there's also a spot for like a memory card. Oh, it's charging.
Yeah, I can't tell if that's what that's for or not. Where did the little USB dingy go?
Oh. The USB dingy.
Yeah.
What USB dingy? Are you talking the manual book?
No, it looked like there was
Well, there was this.
Yeah, but it looked like there was something to plug into the computer. I don't know.
This?
Maybe I was just imagining it.
I don't here, look through that and see if there was something else that was supposed to have came with it. Alright guys, well, hopefully the next time I film it will be with this guy and it will be much better quality. So if you like this video, give it a big thumbs up. Don't forget to subscribe to my channel, and we will see you guys next time. Bye.
Bye guys.
So I was sitting here and was trying to get this video edited so I could get it up for you guys, and we got a call from our doctor's office. So backstory, my dad's work has just switched insurance. And so our old insurance ends on December the 31st, and our new insurance kicks in on January the 1st. My surgery is supposed to be on January the 2nd. So my surgery has to have pre-authorization, which can take up to 2 weeks. There's not enough time to get pre-authorization in 24 hours. That could, take 2 weeks. So I will not be having my surgery on the 2nd anymore. And I literally just spent like the last 20 minutes bawling my eyes out because it seems like we get one step closer to, hopefully trying to figure out exactly what is wrong and fix the situation, and then it's like 5 steps back. So I was really, just sad and down about it, and we almost just decided to pay out of pocket for it. So I had 3 choices. I could do it in January the 30th. I could do it January the 30th. I could do it February the 20th, or I would probably have to wait until this summer, because now that it's a new year, everybody's wanting to use their deductible, or they're not wanting to use their deductible. Everybody's scheduling their procedures So that way that procedure will eat up their deductible. So like almost everything is booked up until like this summer. So we went ahead and we took the January the 30th, and I will tell you the only issue with that is the fact that I had quit my job and decided like this was a stupid idea. Why did I do this? And went back. So I go back, but then I have a bulging disc in my back, and that was giving me issues. So I was out for another 2 weeks, so it was 3 weeks total. And rather than, I was technically unemployed with them for 3 weeks. And rather than bringing me back as a new hire so I could keep all my time, they just went ahead and used all of my time so they wouldn't have to go through all the paperwork and stuff, which was fine until now because I have no time. So we get more time towards the end of January. So I'm hoping that time frame will match up. So that way I will have some more time that I can use. If not, I guess I'll just have to take a leave of absence, which will be unpaid. But I didn't really want to wait until February because I would have been in the same situation, basically, depending on how much leave they gave me. You know, it may not even be enough leave for me to take Tuesday, Wednesday, Thursday, 3.5 days. So I don't know. We're just going to have to play it by ear, but I am going to have the surgery on January the 30th. So just, it got pushed a few weeks ahead or into the future, behind. I don't know how you word that. But, yeah, if I wouldn't have done it that way, I would have been probably waiting until this summer, and that really wouldn't have worked out because I'm supposed to be helping my stepdad put in a new ceiling in our living room, and you can't do that when you just had surgery. So, yeah. Anyways, we've got it changed. We've got it fixed. I'm a little disappointed that I'm not going to be having it as quickly as I thought I would, but that's okay. Fingers crossed. Maybe, you know, God just has other plans, and maybe I'll get pregnant this month. I am taking my letrozole a little bit differently because I usually take it cycle day 3 through 7, which would have been yesterday. But since we didn't find out until today about the surgery needing to be moved, I'll be taking it days 4 through 8. So I'm hoping maybe that will give the egg more time to like mature, and maybe we'll have better luck with that. So fingers crossed. We're hoping maybe I just won't even need to have the surgery. I know that God has a plan and a reason for why this is happening the way it is. So I'm just gonna have to trust, you know, what He has put in front of us and roll with it. But yeah, I just wanted to come back really quick and update you guys on that. We will see you in a couple of days for Christmas, and I want to say thank you for subscribing and supporting us and being a part of our family. We love you guys, and we will see you next time. Bye.
I got a stethoscope here, so I can see. You should make sure you got a heartbeat.
Okay.
Yeah, pretty sure you did.
I hope so. If not, this could be really awkward.
Yeah. It could be really awkward. Find out you're an alien and suddenly there's a spike coming through my head. You know, I've seen the movies.
Oh.
Records are really slow right now. So, okay. what we're going to do, I think we have a plan for you, is, I'm gonna look at, usually we have surgery requests sent. Huh. It's Candy. Oh, there's surgery information, okay. You know what hospital we're doing this at?
Earlier East.
Okay. Here we are. Okay. So the procedure is, and I may have described this to you before, but forgive me, I'm going to tell you again.
You're fine.
Okay. We get you into the operating room, and the anesthesiologist, but on the way in, gives you kind of they start giving you stuff and get you kind of ready to roll.
Okay.
And then you'll be asleep before you know it. Okay, and then they will put a breathing tube in your throat. You may not even know you have one, but it's important to do a breathing tube because we don't want you moving your abdominal muscles to breathe because that'll move our instruments. So we kind of need to take over.
Okay.
So once you're intubated, we put your legs up into some padded stirrups. They're not like the ones you have in the exam room. They actually support your leg all the way.
Oh, okay.
And they're off to the sides, and then we basically clean the abdomen and lower portions with an antiseptic solution.
Okay.
Soap. And I don't usually have to put, if you empty your bladder right before we go, I usually don't have to put a catheter in.
Okay.
Okay. If your bladder is full, we can sometimes tell by looking at your lower abdomen, and you're so slender, if you have a full bladder, it will show.
Okay.
But if you didn't go right before, we can do it what's called an in and out catheter. That's
Okay.
just a tiny tube that we put in, drain your bladder. You don't want a really full bladder when you're just poking holes in the tummy.
Yeah, that doesn't sound like a good idea.
With the water balloon, you don't want to pop.
Okay.
But usually you don't need a Foley. The only time, in those cases, if the case ends up going really long for some reason, sometimes, with all the fluid you're getting, your bladder fills up, and then we need to put one in. But usually you don't need, to have your bladder drained.
Okay.
So then, once we put the sterile drapes over you, we'll be able to see your tummy, and I'll make an incision in the belly button. And it really depends on your belly button. We try to make it as cosmetic as possible. Like if it's a real deep belly button, we may go, this direction, up and down.
Okay.
Okay, down into the hole. And the incisions are usually, it's about that big.
Okay.
If it's a really shallow belly button, I'll go kind of on the lower edge, trying to kind of hide it in the curvature, side to side.
Okay.
Okay, so it'll be like a smile inside the belly button.
Okay. I'll just go ahead and say I already have a huge incision right here, so I'm not worried about my belly button. Just do what you need to do.
Okay. So then what we'll do is we'll fill up, through that incision, there's a, basically, you've seen the inside of a pen. It's about that width. It's called a Very's needle.
Okay.
And it's about as sharp as a pen tip. You just put that through the incision, and you can tell kind of by the layers you're going through. You kind of get used to that feel. And kind of when you're inside the abdominal cavity.
Okay.
What we do is I lift up your tummy with my hand and put that in. And then what we can do is fill your abdomen up with gas. And that lifts up your abdomen like a circus tent.
Okay.
Okay. And so the abdominal wall's up here and the intestines are all down here. We then can take a hollow tube called a trocar, and put it into the incision. And it gives us plenty of space so that we don't hit anything vital.
Okay.
We'll take a look around, make sure that we didn't, nothing was traumatized. I'll see if there are any adhesions from the appendicitis that you had, because sometimes you can get scar tissue and stuff.
Right.
And that'll help me understand where to put my other instruments.
Okay.
I will also put a device in your uterus, and I wish I had a copy of it here, but it's kind of it's kind of a C-shaped device. It's like a tube that's long and C-shaped.
Okay.
Okay, and it's really it's rigid on one end, and what it makes it is like a handle that we can put that directly into your uterus, and I can lift your uterus up. I can move it to the sides, just by pushing on this little handle.
Okay.
Okay, it's called a uterine manipulator. So it's got a little balloon on the end that, it's kind of like a catheter. So if you have some bleeding, that would be, vaginally, that would be one.
Okay.
Okay. And that allows me to like stretch out the tubes, see behind the uterus. It's just, very low risk to doing it. Theoretically, you can perforate the uterus with one of those. I've seen it done. I've never done it.
Okay.
But so I know it can happen. The only time I've actually seen it done was on I've heard of it being done. The only time I've ever seen it being done was on a difficult uterine surgery case where somebody's having to push up really hard on it to try to bring the uterus into view, but that's not going to be the case here.
Okay.
We're not going to have to push that hard.
What happens if that does happen?
Remarkably, the uterus almost always heals very well without any assistance from us.
Okay.
We would end up, out of an abundance of caution, when I have seen uteruses perforated, when you come up through a residency training program and, you have some gung-ho people, I've been in the room when it's happened. I've never done it, and I've never instructed somebody while they did it. You know what I mean?
Mm-hmm.
So and so those were actually really instructive for me to see. You can imagine, because I say, okay, you got to tell people exactly what they're, nobody, I'll be doing this, so you don't need to worry about that. Okay.
Okay.
But it was very instructive to me to see how people did it when they did it, because I've never done that.
Okay.
So, at any rate, that'll go in, and then, so depending on what the lay of the land is, depends on where my other trocars go.
Okay.
So I'll generally put, 1 to 3 other trocars. So if you have a lot of adhesions over here, I may end up putting 2 over here so I can take care of those adhesions on this side, because you got to put them on the opposite side of where you're working.
Okay.
Then once you get that clear, I may end up with 2 over here too. I don't know, but usually it's 2 or 3, and
Okay.
that's all you need, in addition to the belly button. If we get in and we see any endometriosis, I'll do everything I can to obliterate, vaporize, or remove it.
Okay.
Whatever is the safest and most effective for that region.
Okay.
If it's not safe there's certain ones that it's actually safer to cut out than to vaporize, and others it's safer to vaporize.
Okay.
So, but we will destroy all the endometriosis we can.
Okay.
Okay. I believe your tubes were open at HSG, so I don't have to run dye through your tubes. No, this one was indeterminate.
The right one, you had said that it was partially, and then they terminated, and then the left one you had put that there was
loculations.
What is that word?
Loculations.
Is it like
fluid collections
okay.
outside? But outside the tube, we'll run some dye through your tubes to see that if this is open or what the issue is with it.
Okay. So does that mean on the left side then that the dye is leaking?
It's going out here.
Okay.
Like it's supposed to.
Okay.
And then it's collecting in something.
Oh.
So so the dye, when an HSG is completely normal, the dye goes out and it spreads like smoke through the abdomen. You'll see it kind of outlining little curves of intestines, but it still goes everywhere.
Okay.
Okay. Loculations tend to stay, you'll get like a dense concentration in one little focal area. Now, that doesn't mean there's pathology there.
Okay.
But when there's adhesions, that usually, it's like cellophane. It creates like things that just kind of stay there, they don't move. So an adhesion will, if you fill it will look like a lot. That's what a loculation is.
Okay.
Could you have a little loop of intestine that was there, and it was just like a little loop that wasn't moving? Your intestine is not, it's not just a tube that snakes through your body. It's actually attached all along one side with what's like a drape. And so it's like an end of what if you have a loop of that drape just sitting there during the time we did the HSG, you know, we could get over there and we might see nothing that explains that loculation. And if that's the case, it was probably a loop of bowel that trapped the fluid for a little bit.
Okay.
We could see something on that side that explains the loculation but has no effect on your fertility.
Okay.
Okay. Of course, we could see something that has a big effect on your fertility. We don't know.
Right.
We just know that, you know, if we do 100 x-rays and with findings like yours, we're going to see more abnormalities in women like you compared to women who have a completely normal x-ray.
Okay.
Yeah, but this, just because you have abnormal findings does not mean your anatomy is abnormal. Okay.
Okay.
It's not 100%. So that's a risk of surgery. You gotta do. Okay. So, but that's not likely.
Right.
Okay. So my goal is to restore normal anatomy as best we can.
Okay.
And ablate any endometriosis that we find. Okay. It is possible, but not common, that we find something we didn't expect to find. It's the rarest of situations where I've had to come out and had the husband make a decision, should we remove the tube or should we remove now? If this tube is blocked here and not filling up here, it's not helping you, and you may do better to take it out. Now, if it's blocked here, we can try to open it.
Okay.
Okay. But a tube that's blocked midway and it's dilated through here, I would probably take out, because whatever is causing the blockage often causes inflammation, and that inflammation drains back this way. And when women have these blockages that you can't open, they have lower pregnancy rates even if they do IVF, because of that toxic fluid that comes back this way.
Okay.
So there's a possibility we could take out a tube.
Okay.
That, you know, but as long, I would only do that if we've talked about it now and you agree, and you can think about it. You can say, you know, you can tell me the day of surgery, don't whatever you do, don't take out either tube. You know, we can talk about it again.
Okay.
But this tube, you know, we know is open. So even if I do surgery and I don't see any dye come out this tube, I'm not worried, because I know it at least anytime we do something, it can cause uterine contractions, and it can make the dye not go out the side. If I put dye in and this tube's open but no dye is even getting into this tube, I know dye got at least to here before, so I'm actually less worried about that too.
Okay.
Because it's only if I see it dilating up and there's a stricture point, like in the middle of the tube, but I say that really needs to come out.
Okay.
Or for some reason it's unfixable.
Okay. Well, my thing is, if he comes out and you just are like, you get in there and you're like, you know, don't really think there's any hope for this, just go ahead and take it out. That's fine.
But I want to leave you with one too.
Yeah, please leave me with my good one, please.
Yeah, so and I'm not really anticipating, I'm just using that as an example of occasionally something you just don't expect.
Okay.
You know, I've had to take an ovary out that I didn't expect to because it had a tumor in it that was malignant. You know, that's not, but you don't have cysts that we're following.
Right.
So remind me, any allergies, drug allergies?
None. I just prefer no Phenergan through an IV.
Did you take Phenergan on its own?
I can take it orally, but every time they've tried giving it to me through an IV, I start like hallucinating on it.
Well, I don't have to give you Phenergan. I can give you Zofran.
I would prefer Zofran.
Okay. Zofran can be constipating. I give you these ahead of time so you can fill them,
Oh, okay.
and that way you're not having to stop on the way home from a pharmacy. Clearly have a reliable patient population, otherwise I wouldn't be doing that. The orthopedic surgeon wouldn't give me my prescriptions ahead of time. Like, why not? Stop on the way home. But guess how many pain pills I needed? 0. Which was amazing. You know, really. So if you ever need some shoulder surgery,
I was gonna say, what did you break?
I had rotator cuff surgery.
I probably won't end up taking any pain medicine for this.
Well, the one that actually helps the best is the Motrin at high dose. I mean, it's amazing. The narcotics really don't do nearly as much. And I give a very small number of narcotics for these because, you know.
I do typically like Motrin.
Okay.
That's usually my go-to thing.
I tell you, if you take 1,200 milligrams of Motrin, if you really have a lot of pain, you can take a single dose, or a couple of doses that high. It is amazing what it'll knock out. The thing after surgery that really helps most people is the Toradol.
I have been on that. I was on that. I hurt my back really bad and broke my tailbone in cheerleading, and they did give me that.
Especially the injection. Yeah, did they give it to you?
They gave it to me through an injection.
Yeah.
This is like my 6th or 7th surgery that I've had, so I'm not too worried. I trust you.
Shoot. Dadgummit. You don't want to make any mistakes on a narcotic prescription. I can't just put the wrong interval. I was giving you, and then I'm going to give it to you every 8 hours. I meant right every 4. It seems like ridiculous. These are double strength Percocets, so it's actually 10. Standard Percocets, you probably won't need that much, but just in case. One, 3, 6, 10. Got all your Christmas shopping done yet?
I think we just finished the last bit of it before we came in here today.
This is not a Christmas present.
Okay.
To someone. Got you some Percocets.
Yeah, no.
So, okay. All right, let me just listen to this.
You need me to take this off?
No.
Okay.
Okay. Deep breath. Good. Deep breath. Just listen to your tummy. Okay, that way I can at least say I've done that. So after surgery, you'll go to recovery, and then, typically most people, if we operate on a Tuesday, most people are back work by Monday. It just depends on how much lifting you need to do.
Because that was going to be my question, because I just work with pre-K, so really there is no lifting, and I'm supposed to be back on the 8th, so do you think that'll be
That'll be
okay?
fine.
As long as I make sure that they don't, grab at my stomach and stuff?
Yeah, as long as
Okay,
they're not
perfect.
kicking you. I mean, it's fine. I mean, they're not gonna, it'll be tender, but it's not gonna hurt you. It's not gonna knock anything loose.
Okay.
So.
And you don't want me taking my Femera this month, right?
Not if you're,
Okay.
no, not yet. I mean, for you, it doesn't really matter when we start it. Right, yeah, so.
Okay. Just today would have been cycle day 3 for me, and that's when I've been
Yeah.
taking it, so I just wanted to make sure that.
Yeah, because if it makes you have a cyst, then I'm gonna have to,
Okay.
So I would just do. You can take it after surgery.
Oh. I will need a refill of that, by the way.
Okay. You need a refill?
Yes.
No.
that was kind of my next question, or my next statement to that.
Lexington, okay. What pharmacy do you use?
CVS on Battlefield Parkway.
Battlefield. Is it, which one is it? Did I get you the right one every time?
Yes, sir.
Okay. I was sending the one I've been sending it to.
And then typically how long of a procedure?
For you, wake up.
Okay.
For you.
Obviously, yeah.
I mean, it depends on what I try to do is, I say, expect me within an hour, usually. If it's gonna be much longer than that, I usually have them call out to you.
Really?
Yeah.
Okay.
And so within an hour, I mean, so it could be 30 minutes. Now, from the time you leave the room, because you'll both be in a room
Mhm.
waiting for you to go, from the time you leave to the time you're asleep and I'm operating will be about 15 to 20 minutes. Okay? So include that in the hour.
Right.
Does that make sense from the time you leave the room? So if it's gonna take me much more than 45 minutes of operating, I usually call out to the family just to kind of give them a heads up, say, hey, there's a bunch of little things to do here. We're gonna, I'll probably be fine. I'll try to give you an estimate. That way, if you wanna go get a cup of coffee, you're not just, you're gonna have a buzzer.
Okay.
Yeah, but you don't need to feel like you're a prisoner to the room, but
Okay.
sometimes people want to go across the street to dinner or something, and
Right.
they just make sure we have your phone number. Okay. So.
And then, so I guess we'll see what you find in the surgery, and then we'll discuss after that, like,
Yeah.
if,
Yeah, a lot of times,
why I'm not getting pregnant with the last tube.
if we think that if there's anything different that should be done.
Okay.
But we're just parking at the wrong train.
So I have a awkward question.
Yeah.
How are you enjoying the house?
Good. Wow, did you see our show?
Yeah.
That's great. We're doing an addition soon.
Wonderful.
Yeah, my wife is, she wanted to move out as soon as we moved in, but she's a frequent flyer.
Yeah.
And, so,
Yeah, I don't remember where I was watching it, but I was.
Okay.
Was it Pietro?
oh, okay.
And I was just like,
Oh, hey,
That's
my daughter.
That's so funny. Yeah, it's, I really didn't want to do the show, but what I really didn't want more than that was every time that show came on, was my wife to say, we could have been on that show. Why didn't you do that? Have that resentment forever. So anyway, all right, I will see you in a second.
Okay, thank you.
thank you. Have a good one.
All right, let's see.
Okay.